Hello, ladies and gentlemen. I'm delighted to welcome you to this presentation on this fascinating and essential topic of growth and development. So, today we will embark on a journey to explore and explain the processes that do shape individual from infancy into adulthood. This topic is not fancied by so many students, and I don't know why. Unfortunately, so many questions tend to come from this topic, especially from the NCLEX and the Nursing Council of Kenya. So that means what, guys? We have to give it some time. Okay. So in this topic, we are going to simplify these concepts related to growth and development. So welcome and let's do it together. So growth involves the physical changes in height, weight, and the physical appearance of a body. Development, on the other hand, refers to the functional ability such as the cognitive, motor, psychosocial aspects of the client in that case. So, growth and development, these are two concepts that normally begin and start at conception and progress until a person dies. So growth and development can be understood using several theories. So these theories, they provide a framework for us to understand these wide changes. So learning this will help us as healthcare provider, especially nurses, to provide the individual nursing care using the nursing process for these clients based on the stage of development. In addition, they do provide anticipatory guidance for both parents and caregivers for that matter. So we have a number of developmental theories that help us explain these concepts. Biophysical development theory by Gesell, psychosocial development theory by Erickson, cognitive development by Jean Piaget, moral development by Kohlberg, and psychoanalytical development theory by Sigmund Freud are just a number of theories that are very key in explaining these concepts. So understanding these concepts will help us at least explain the different social, physical, emotional development in a person. But first, before we proceed, we have tried to divide these stages of growth and development in phases so that we have infants, toddlers, preschoolers, school age, adolescent, young adults, middle adolescent, and old adults. Okay. I think one of the frustrating things that students do face is sometimes even from reputable sources where people are not able to agree on the age ranges for these different phases of life. And so that's sometimes frustrating. But we are here to encourage you and tell you that here we are going to simply simplify these facts and use the widely accepted age ranges in our presentation. But before we proceed, we have to look at some of the two scientists, and these ones, they have two concepts in each case, which is very key for our practice as nurses in terms of growth and development. So we have the Gesell theory of biophysical development. For him, he proposes two patterns of development and two patterns of growth in this case. So we have number one pattern, we have the cephalocaudal and the proximodistal patterns. So the cephalo in anatomy, we say that the cephalo refers to something relating to the head and the caudal is the tail. So growth is happening from which direction to which one? Starting from the head towards the tail. So growth means that the head and brain will develop first, then it will progress to the feet. On the proximo-distal growth, it means that the central parts of the body, like the heart, okay, are going to develop first. Then we can have the arms and the legs. On the other hand, we have the Sigmund Freud, who came up with two complexes. We have Oedipus complex and Electro complex. So Sigmund, of course, was a Greek a Greek philosophist, and he came up with this concept. And in both concepts, we have the Oedipus complex, which is more associated with the boys, and the Electra complex with the girls. So in Oedipus complex, you find that a child will develop this unconscious feeling of desire for the opposite sex parent. So they start, like for the Oedipus complex, they start rivaling with the father for the attention of the mother. Okay. However, this one they normally resolve through identification with the father and the development of the super ego. We also have the Electra complex, and Electra complex, this one is more associated with the girls. So they go through similar stage of desiring their father and experiencing some kind of rivalry with their mother. However, and luckily it is resolved with identification with the mother for that particular case. So guys, in our presentation today, we are going to concentrate on the two scientists, as we have said, about Erikson and Jean Piaget. And we'll start with the first stage, the infancy stage. So, and the infant stage for Erikson, he says that the major task here is gaining trust and overcoming this mistrust. While the Jean Piaget on the cognitive aspect is looking at the sensory motor stage. So in Erikson, we know our main objective in Erikson is to achieve something, achieve a task. So the task here is gaining trust. So a child will gain trust if we meet their nourishment needs, we feed them when they are hungry, we bathe them when they are soiled, we comfort the child when they are crying. So we need to respond to the child cries. So when the child when this one is done, the child is able to gain trust. And when they gain trust, they feel safe and secure, and thus are able to move to the next stage of development. If that is not done, then they'll be stuck in mistrust because we are not responding to their hungry crews. We are inconsistent in responding to the infant. Sometimes we respond, sometimes we don't, and we don't do it promptly. Okay, we are not meeting the child needs. So when this happens, the child is going to gain mistrust and is going to be stuck in this stage. As a result, they're going to develop more higher levels of anxiety. Okay, correct. So on the cognitive aspect is by Jean Piaget. Jean Piaget tells people how learning occurs by interacting with the environment. Okay, and these sensory motor stages is between 0 to 2 years. So here in this case, you find that knowledge is gained through senses and motor movement. So we collect information, we process it, analyze, integrate it in our normal life. Okay, so we could learn through circling, we could learn through grasping, looking, and listening. Okay, at this stage again, another important thing is that the infants start to understand the cause and effect phenomena, where they can be able to throw some objects on the floor and they make sounds. Okay, they will be amazed by this experience. Okay, so they're so excited about it. However, the concept of object permanency has not developed. Okay, it's gained around 9 months. Object permanency is simply the concept where we need to kids understand that objects or some things will continue to exist even if it's outside their sight. Okay, so what happens when these infants are sick? Remember, these infants, they are still gaining trust. So anything that you do as a nurse, you must facilitate that process. So during hospitalization, there must be consistent caregivers. There must be consistent healthcare providers who will be providing care to this child so as to cultivate that atmosphere. So the nurse should focus on developing trust. Caregivers should at least try to ensure that they attend to the needs of this baby consistently and promptly so as to develop trust. So we have some milestones at 3 months and 3 months. So and to help us understand that, we normally use a 3-letter word, coup. Okay, you need to know that helping, just knowing the different milestones is going to also help you detect if there's any evidence of child abuse for the different children you're going to be providing care to. Remember, it's your mandate as a nurse to report child abuse and also adult abuse to the authorities. So these 3 words, the coo. So the baby will be making cooing sounds. So they smile at people. They emit some distinct cries for different needs. Actually, the mother is able to tell which type of cry is that. Is it for feeding, or is it for changing the diapers? Okay, or is it just for any other? Okay. So they're able to recognize familiar voices. They do express different pleasure and displeasure sounds. So they jiggle when they are happy, and they can cry when they are in discomfort. Okay. At this stage, guys, it's good to know that the baby will be able to hold the head up during tummy time, and posterior fontanelle should be able to close. The posterior fontanelle normally closes by 6 weeks, but in some cases it could extend to 2 months or so. That needs to be confirmed at this time. So in Kenya at this point, we'll be giving the first dosages. All right. What about the milestones at 6 months? Okay. At 6 months. So remember, at 6 months, we use a 6-letter word like the bubble. So your baby should be able to bubble and repeat syllables like ma, da, ba. They should create giggling sounds, giggle and laugh more, and they should notice and recognize sounds and can use voices to express displeasure or pleasure. They can also make turns in making those sounds. So remember, from birth to 6 months, the baby will grow at a rate of around 0.5 to 1 inch a month, and the birth weight will be able to double at 5 months. All right. What about at 9 months check? What happens at 9 months check? Yeah. Remember, at 3 months they were cooing. At 6 months they are babbling. Now at 9 months they are imitating. All right. Yes. So at 9 months we use the 9 letter words. 9 months, 9-letter word. Imitation. Okay. So the baby will imitate speech sounds, non-speech sounds, and action gestures. They could recognize their own name and shift gaze to objects being spoken about. The cup, then they follow. The table, the ball, the dog. So they could string together a long series of sounds like the syllables. So you could have mama, mama, dada. Like for the other one, you're just hearing the da. Okay, but now here is mama, da da da. Okay, so the baby can sit without support, and that is so significant at 9 months. Remember, at 9 months, if you are in Kenya, you are giving the first dose of measles for the non-exposed babies and the second dose for exposed babies. All right, at 12 months. So at 12 months, for us to remember that we have 12. Okay, it is 1 and 2, so we say we have 1 or 2 words, so the baby can use or communicate using 1 or 2 words. Okay, 1 or 2 words, so they begin to understand words, request phrases, instructions. Okay, their favorite word at this stage tends to be no, 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 no. I know some of you have interacted with the toddlers, and you can bear with me witness. So they begin to understand those words, and they can answer simple questions non-verbally, and they can recognize. Okay, familiar objects. It's a ball, if they know the ball, the dog, the cat, the shoe, the cup, the table. Okay, it's good to know that from 6 to 12 months, the baby grows at about 3.8 inch per month. Okay, so they're able to gain weight, and at 12 months, their birth weight triples. Remember, at 6 months, at 5 months, it doubles. Okay, another significant milestone here is that at 12 months, this child is standing. Okay, they pull up a stand at 12 months. What about at 1.5 years? 1.5 years is equivalent to 18 months, and that is very key for us to understand this concept, because 18 months, remember, 18 words. So the baby can speak with a vocabulary of 18 words. So they repeat words overheard in a conversation. They recognize and point to familiar objects and people in pictures or books, and they understand simple questions and follow simple commands. They can point to body parts, head, thorax, abdomen. The child at this stage, they normally walk unsupported, and the anterior fontanelle, that's the pregma, should close at this age. So at 18 months, the anterior fontanelle has closed. Remember, in Kenya, if you are there at 18 months, you're giving the second dose of measles for non-exposed, and the third one for exposed child, which is so key for ourselves. When doing this assessment on these developmental milestones, it's also important you pay attention to the reflexes. So because the nurse should be able to assess at least 4 major reflexes along the different developmental milestones. Because having this reflex or lacking them, they could indicate problems with the nervous system. Okay, so may be present at birth, which is normal for infants, normal for newborns, abnormal in adults. But these reflexes will also diminish at some expected ages. So if they fail to, then that becomes another neurological problem. So abnormalities in newborn period could include absent developmental reflexes, maybe big asymmetrical, persisting beyond anticipated age at which they need to have diminished for that particular matter. So the first reflex to elicit is the motor reflex, the startle reflex, for example. So, and this is how you do it. How do you elicit? You need to hold the baby in a semi-sitting, and then you allow the head and the neck to fall back. Of course, supported. They are not ready to support themselves comfortably, so we have to support them on this, of course, and this one should be at 30 degrees. Okay, so some response can be elicited even just by making a loud noise or clapping. Okay, clapping, and you can see how they do respond. When do we say that the startle reflex or the motor reflex is present? When the newborns extend, okay, they do extend and abduct, followed by flexing and adducting. Okay, so they do that movement: extend, abduct, okay, flex, adduct. Okay, so it's usually present at birth, okay, and but absent at about 6 months. Okay, at about 6 months. So when it's persistent response after 6 months, it could indicate that there is a neurological abnormality for that particular matter. What about the Babinski reflex? This is the second one. It's also referred to as the plantar reflex. So in this kind of reflex, you use a safe but hard pointy object like a pen cap. So you stroke the newborn's foot, stroke the newborn's foot. This one is on the lateral aspect towards the pinky toe. and then you cross the ball to the foot of the big toe, okay, of the big toe. Okay, so when it's present, what do you expect to happen? The newborn toes will hyperextend and fan out, okay, hyperextend and fan out, okay, hyperextend and fan out. But when absent, yeah, yes, okay, correct, guys. So you find that it's normally absent as newborn. When it's absent, it indicates this neurological abnormality. However, this reflex can also be assessed in adults. Okay, when it's positive in adults, you assess it because this one we want just to determine the presence and the extent of CNS disease in this particular patient. The third one is the Palmar grasp reflex, and this is my favorite. How do you elicit it? It is very simple. You simply place a finger in the palm of the newborn's palm, and then the newborns will wrap and curl the fingers around the finger in the palm. Okay. It's normally present at birth, but it will diminish at around 3 to 4 months. The last one is the rooting reflex, and this is very important for breastfeeding, guys. Okay, so you simply stroke the newborn's cheek, okay, at the corner with a finger or a nipple, and then the newborns will turn. Okay, they will turn. They will turn, so they turn towards the finger or the nipple and open the mouth, ready to latch on the nipple. Remember, this reflex is very important for the feeding of this infant. All right. So it's normally present at birth, but it will diminish 3 to 4 months. But it's good to know that it could remain for up to 1 year. Okay. So what education are you supposed to give to this particular age group? Remember, most of the education will be and information will be directed to caregivers. Okay, so communication using nonverbal, such as touch, are very essential just to make sure that they are gaining the trust. And you always place your baby on their back when they want to sleep, because if this one will help prevent this other choking and suffocating. Okay, which keeps them from breathing. So they have to be on as a firm mattress with tight fitted sheet. They put on the back. You normally put them on the back, and a pacifier may be used, but avoid stiffened animals or blanket in the crib so as to avoid suffocation. Remember, when you look at the weight of the infant, I think we have already mentioned this one. It should be able to double at 5 months, okay, and triple at 1 year. Car seat safety is very key, especially in US, where you need to ensure that children are in a booster until they are around 145 centimeters, which typically occurs between ages 8 and 12. But at reaching this one, children must still ride at the back seat until they are older than 12 years of age. Okay. In terms of vaccinations, if you're in Kenya, we have the birth vaccinations, or the first 2 weeks, within the first 2 weeks, BCG and OPV. But if you're in US, hepatitis B is the first vaccine that most babies will receive, and it's given within 24 hours of birth. So your baby will also get a second dose of hepatitis B vaccine when they are 1 month to 2 months, and the child dose when they are 6 months to 18 months. Influenza vaccine, which is normally given yearly, will commence at 6 months. Okay. So from there, we now can look at now toddlers. From infants, we look at toddlers. Remember, from Erickson, we have been working on trust versus mistrust. And the gene Piaget, we are looking at the sensory motor. But now for here, we'll be looking at autonomy versus shame and doubt versus pre-operational stage. Okay? For Erickson, the task here is autonomy. Children need to become independent. They want to be trained, and which happens within the 2 to 3 years. They want to choose their own clothes. They would like to dress themselves. They like to at least be given food choices. so that this will allow for some kind of independence. Remember, if children are successful at this stage, this second stage of Erickson, then it will allow this child to become partially independent. However, they could stagnate in shame and doubt if they are punished for mistakes and if you doubt them, okay, and when the child isn't allowed to make independent choices. So please don't make them doubt themselves. So failure at this stage will lead to self-doubt, okay, and they'll stagnate in this shame and doubt and fail to move to the second stage. Cognitively, according to Jean Piaget, we have a pre-operational stage. Okay, previously they were using senses in the sensory motor to learn, but here now they're going to be thinking symbolically, but not able to do it logically yet. Okay, so they use symbols and gestures to represent an event, and this is within the 2 to 5 to 7 years. They typically focus on one area of situation. They are very egocentric creatures at this point. They only think about themselves. They struggle to see things in others' perspective. Okay, so and this one is very very key at this stage. So to help them overcome this, you need to develop. You need to help them. You need to involve them in the whatever you are doing. Okay, you use action along with words, visual aids. Okay, in that case, what happens when they are sick? How are you supposed to help the toddlers cope? How are you supposed to help them develop out of this stage so as to get to the next stage? Okay, you have to help them develop autonomy, provide them with choices whenever possible, allow these toddlers to have favorite toy from their homes. Okay, now, these toddlers are one of the groups that is at very highest risk of developing separation anxiety when left or with their parents. And they go through three stages. They could protest in the first place by just crying or screaming and being inconsolable. And this happens for like several hours and several days. Then they become withdrawn, hopeless, and apathetic, and this despair. And lastly, this now will happen after prolonged separation with the parent. The child will appear more adjusted to the loss. They become more interested in the environment. Even if the parents are around, they appear to be happy and content with caregivers and other children, and not their parents. And that is detachment. Toddlers do exhibit some unique plays, and one of it is the parallel play. It's very funny, guys. You can be able to see it on my right here, the two ladies just concentrating on their own paints, okay, not interested with any other. Okay, so these toddlers, they'll play adjacent to each other but not try to influence another's behavior nor interaction. So they are still very egocentric. They only think about themselves. We also have symbolic play. This is the ability of the child to use objects, ideas or actions to represent other objects. The boys, for example, you could find them with a gun, a toy gun, and they'll be shooting. Okay, douche, douche, douche. So that's symbolic play that you have. So they're going to pretend to be several people in the society, and that is so key. So we have some significant milestones at this stage at 2 years. So remember, 2 years, two word phrases, two step directions. You can use two word phrases to talk about things. They can follow two step direction. You can request them, please pick that cup, give it to me. They are using 2 years, two step directions. They have a vocabulary of about 50 and more words. They speak well enough to be understood by caregivers at least half of the time. Okay, of course, we could have occasional where you are not getting, but half the time you get it. Okay, they use gestures and words for pretend play, and they can make animal sounds. They can kick a ball. They can run. Okay, this is all about the gross motor. Remember, one thing that you really need to know is that at 2 years, they have already achieved half the length or height of adults. So what are you supposed to teach these adults? In terms of communication, you have to involve them in the care, show the adults the medical equipment, and allow the toddler to handle. Okay, demonstrate using a doll or a favorite toy, because these guys are very eager to learn, they are very eager to be involved. Talk in simple terms so as to be understood. In terms of safety, it's good for you to recognize that this is a very high risk age for injury. So you avoid foods like popcorns, grapes, hot dogs, because this can likely lodge in the esophagus, leading to choking. You ensure that water heater is set at 120 degrees Fahrenheit or below to avoid accidental injury. Remember to convert degrees Fahrenheit to Celsius. You simply subtract 120 minus 32. You get 88, divide it by 1.8. You'll be able to get the 48.9 degrees Celsius. So use the back burns while cooking on the stove to avoid unnecessary burns. And this one, you have to know that they can go forward facing in the car at this age too, and continue with the vaccination. From there we go to preschoolers, guys. Okay, from the preschoolers. Remember, we've looked at the infants, we've looked at the toddlers. Now we are looking at the preschoolers. Number 3, preschoolers. And according to Eric's, we're looking at the initiative versus guilty. This is within 3 to 5 years. For Piaget, there is no stage here, new stage here. They are still egocentric. So they are still pre-operational until 7 years. So for the Erikson, the task they are trying to achieve is initiative versus guilty. They want to take control of an environment. They want to involve in planning and accomplishing tasks. So the caregivers need to be very careful here so as to try and model their behavior. You allow the child to make own choices, okay, if possible. You set some safe boundaries. When successful, these child, they usually develop a sense of purpose. However, if not, they stagnate in guilty because of the judgment that you are subjecting them to, harsh criticism, and they start being over-dependent on others. So failure in this stage leads to lack of confidence and feeling of guilty. So during play, they exhibit cooperative play and magical thinking. So cooperative play will involve division of efforts among children in order to reach a common goal. And you can see, like right now, at least the world is opening a little bit. They are able to view it in perspective of others. They have a funny play here, the magical thinking, guys. So this is the belief that their thoughts, desires influence the external world, and this is normally exhibited when actually their younger siblings are sick. They tend to believe that it is their action, it's their thought that has led to the sickness of their younger adults, okay, their younger siblings, I mean. So again, in this case, the caregivers may take some time to really explain to this child that it is not the other way, okay. So during illness, when they are sick themselves, nurses should focus on helping this child develop initiative, a sense of purpose, by allowing this child to make at least their own choices and setting boundaries. Regression may occur when they are sick, and this is a normal thing. So you just need to encourage the parents to continue supporting their child until this acute phase resolves. Once it solves, they can continue developing. You need to be able to bring the favorite toy if possible. Okay, so remember that children do not have the concept of time yet. So if you're talking to them, you'll try to use terms like lunchtime. You're going to take your medication at lunchtime, at bedtime, when the TV show finishes, so that you can be able to understand each other. So milestones are for preschoolers. Remember, 3 years, 3 word phrases. Use 3 word phrases to talk about things. They speak with a vocabulary of around 200 words. Okay, they understand and use pronouns I, you. They speak well enough for caregivers to understand most of the time. So they understand spatial concepts like under the table, on the table, over, outside. They are able to understand that. They are also able to distinguish between plural and singular. Socks, shoes, tables, chairs. They are able to. One of the also striking milestones to know is that the child is able to play with others. The child draws, okay, the child is able to dress themselves, and they can use a fork at this time, okay. They know the name and age at this one, okay. What about 4 years, guys? Remember, 4 or more word sentences. Okay, so the child is able to identify colors. They can use 4 or more words in a sentence. They can use about 4 sentences at a time to tell a story. They understand and can ask how and why something happens. So they'll be asking those several questions, and should be able to answer them. They may also express own ideas and feelings. They speak well for caregivers to understand most of the time, and they group objects by categories. Like they could know the types of food, types of vehicles, okay, types of food, tea, chocolate, food, ugali, sambusa, several. This child can play pretend, okay, they can name colors and they can catch a ball and can undo buttons at this age. So in terms of educating, you're supposed to educate the parents and the children. You allow these children to handle medical equipment, answer simple questions, and explain procedures. In terms of safety, especially the bike safety, yeah, they have to use the helmet. They remain forward facing in a car until height and weight limit has been reached, then transition to the booster. Then you continue with the vaccinations, especially the yearly influenza vaccine. From the preschooler, we go to the school age. Okay, so according to Erickson, we are interested with industry versus inferiority, and that is 5 to 13 years. And Piaget is concentrating on a new stage of development, which is concrete operational stage, and this happened between 7 to 11 years. Okay, so in industry, they are focusing on their peers, guys. They want to develop a form of self-concept, so they are trying to balance some achievements. Okay, you have to keep on reminding them that practice makes perfect. Okay, reinforce effort and practice so that they are able to compete. Remember, they are focusing on academics, competition, social life. They are competing with their peers. So remember, success at this stage will lead the child being able to reach their personal goals and build some significant confidence. However, failure will result into inferiority, especially when you insist on perfection. You make them lack in confidence, and you really focus on their failures, so they will struggle with the boundaries. So failure of the child, the feelings will make them inferior to others. Okay, they feel like the others are better than them. What about the Jean Piaget? Remember the Jean Piaget looking at these 7 to 11 years, and they are starting now to think logically and more organized. So they understand that their actions can be reversed. So the concept of conservation comes in. That is when an object changes shape or size, it still be the same. If you have a cup of water, for example, you pour it something, it remains water, okay? It doesn't change. So they focus on multiple parts of an issue. So they are less egocentric. But be sure there are still some kids who are still egocentric, guys. So during sickness, what happens to this, and how should you handle them as nurses so that you develop that concept of industry? Okay, nurses, you need to know that at this stage, social interaction with peers is prioritized over family. So they want to feel more successful. So industry, so give them opportunities to work. Okay, allow the child to be included in care. Okay, like dress, wear appropriately, encourage friends to visit when appropriate. Okay, so in terms of education, talking to them, you have to do some limit setting so as to model their behavior. You encourage thinking, you use visual, support child's independence. In terms of safety, remember here, fear has really decreased. Okay, so encourage them to use a helmet. Okay, and continue with the vaccination. Okay, remember at 12 years, we have now the monococcal vaccines, the HPV after 9 months. Okay, and the annual influenza. Okay, correct, guys. So the next stage is adolescent. From the school, we have now the adolescent. This is the last stage of pediatrics, as you know, and according to the Erickson, we are working on identity versus role confusion. It does happen between the 13 to 12 years, and you have the Piaget stage. So formal operation 12 years plus so Erickson phase of development, they want to ask them to identify themselves. Who am I? What differentiates myself from others? They want to develop mental and physical health. They said goals, try new things, and be able to relate to others. When they are successful in this stage, they have a strong sense of identity and commit to their value. In terms of role confusion, they are not allowed to be exposure. So if you don't allow exposure, expose your children, they will be in this stage. They are unsure of the self, they lack of self-confidence. When unsuccessful at this stage, remember, they are unable to commit and may struggle with confusion about their future, guys. So how does this translate to cognitive dimension? In this stage, guys, we have formal operational, which is the final stage of Jean Piaget. So 12 years old adults, they have logical thinking and deductive reasoning. They can start to think abstractly and reason about hypothetical problems and can use trial and error for problem solving. They start to think more about others' thoughts and they use organized thought processes. Okay, so how can you help adolescents help develop a sense of identity and avoid confusion, especially during an illness? Remember, looking to establish their own identity. They emphasize on contact with peers. Give them privacy, guys. I know at this time maybe the parents could be feeling that, oh, this is still my baby, I have to be there. Sometimes they need their privacy, guys. Talk about adolescent interests. Okay, like some could be talking about football, about self. Okay, so let them know who they are, support them, answer their questions so that they can be able to be happy about it. In terms of education, help them improve communications with their parents, with their peers, give them some privacy. Talk about adolescent interests, and adolescents may be more focused on the body image. Okay, so safety is still an issue. Seatbelt usage, motor vehicle accidents, they are at high risk. Okay, so talk about safety. Okay, in terms of pipe, some people, they do party a lot, they drive carelessly, so they have to be talked about. Remember about this, the immunization, the meningococcal vaccination and the annual influenza vaccines are very, very key. For the young adults, we have the Erickson stage, which talks about intimacy versus isolation, and this happens within the 21 to 39 years. So in intimacy, these kids, they want to have developed close relationship with friends and families. They have to start families. They want to develop ability to accept and be loved both emotionally and physically. They want to also be able to care for others. Remember, at success at this stage allows for supportive social and personal relationship. In terms of isolation, if they are not able to achieve this, then they'll be stagnating at isolation. So they'll self-isolate themselves, okay? They fear commitment, okay, and the prior abuse, okay, and this could be related to this prior abuse. So failure of this stage will lead to poor health and poor social romantic relationship. The other stage, guys, is the mid-loose adults. According to Erickson, we have generality and stagnation, and it does happen between 40 to 65 years. So this this second last stage, in terms of generativity, these individuals are trying to make contribution to the greater community, leading a sense of accomplishment. Yeah, they want to make contribution to the society, like volunteer, mentor young children. They want to leave a legacy. Okay, they find pride in accomplishment, so they are trying to find a purpose in life. So success at this stage will lead to unconditional support of the community and society, while failure will lead to stagnation that makes them to be self-centered, less satisfied with life, and they don't want to seek opportunity. So they stagnate at this point. So they are unable to solve midlife crisis, and failure to this stage, guys, will lead to someone being uninterested in the people and environment around them. So, guys, the last stage is about old adults, the final stage of Erickson, and this is integrity versus despair. Okay, so this is 65 years and above. In this integrity phase, there is some sense of fulfillment. They are proud of their achievements. They could be having few regrets, but they're able to focus on the good. So success at this stage will lead to wisdom, composure, and peace of mind. Okay, while failure could lead to someone being depressed, regretting so often, and feeling life has very little meaning. They lack gratitude. Okay, so failure at this stage could lead to someone wishing that they could had second chances in life. So you have to educate them. Okay, talk about safety. They have to remove rugs. Okay, they remember the old, so that we avoid unnecessary falls. Remove the rugs, enough lighting, and home environment at home. Okay, another issue that affects this elderly population is polypharmacy. They could be having drugs for every symptoms from different pharmacists. So you have to monitor drug interactions and monitor closely. Next is the neglect and abuse. Some of these ones could be dependent on caregivers who are likely to abuse them. So as a nurse, it's your responsibility to try and see if and find out if this elderly is being abused. Okay. Immunization, we have these meningococcal vaccines. They should start at age 65. Okay, remember their immunity has really lowered and they are at risk of developing these respiratory conditions. So pneumococcal vaccines will be very helpful from age 60, from age 65. So according to Erickson, we have 8 stages, guys, starting with the infancy, which you are looking at trust versus mistrust, shame versus autonomy versus shame and doubt, initiative versus guilty, industry versus inferiority, identity versus role confusion, intimacy versus isolation, gerativity versus stagnation, and lastly, ego integrity versus despair. Okay, generally, guys, in a minute, we have said that in terms of these developmental milestones, most babies will double their weight at 5 months, okay, and it will triple at 12 months. Okay, so we have a growth of about 1.5 to 2.5 centimeters is seen monthly from age to age up to 6, while a growth of about 1 centimeters per month is expected from ages 6 to 12. The fontanelles, we say that the anterior fontanelle will close by 18 months, while the posterior fontanelle will close by the end of the second month. Head circumference usually parallels the percentile for the length. So the average circumference of a head is about 33 to 35 centimeters. And this is about 2 to 3 centimeters more than the chest circumference. The lower front teeth normally appear at age 5 to 9, while the upper teeth will begin to appear by 8, okay, 8 to 12 months. So all the deciduous teeth, that's 20 in total, will erupt at around 2.5 years. So, ladies and gentlemen, that is the presentation on the pediatrics about growth and development. Remember, in our discussion, we have concentrated on Erikson's 8 stages vis-a-vis Jean Piaget's 4 stages of development. Guys, you can take a quiz in the description section to help you better understand and reinforce the knowledge that you have acquired in this presentation. Until next time, guys, it's goodbye from me and see you again.